Hello, I heard that you have a family member with Huntington's disease. Now, understand that you may be worried and anxious, but today, me, Rafae, and John are going to explain to you exactly what this disorder is, the history of it, the symptoms, and overall everything you need to know about Huntington's disease. Okay, so first of all, what is Huntington's disease? Huntington's disease is a hereditary neurodegenerative disease which is caused by a defective gene. So it's a genetic disease which can be passed down. Huntington's disease occurs when there's an error in a gene called Huntington. We'll speak more about this later. So this disorder destroys nerve cells and causes degeneration of brain cells, which affects emotions, thinking skills, and movement. Unfortunately, Huntington's disease is fatal and it currently has no cure. Symptoms of Huntington's disease typically develop between ages of 30 and 50. However, this is just the average age and it's still possible for the disease to appear as early as 2 and as late as 80. People with Huntington's disease usually die within 15 to 20 years after symptoms begin appearing. The pattern of inheritance is autosomal dominant. So this means that each child of a parent with Huntington's disease has a 50% chance of inheriting the disease. Because you can see over here, when an unaffected parent with 2 normal alleles mates with a parent who only has 1 mutated allele, 2 of the 4 possibilities is a child with the disease. Alright, now that we know what the disease is, let's talk about the history of it to get a better understanding of its background. In 1860, a Norwegian physicist named John Christian Lund made the first recorded description of Huntington's disease, and in this description, he talks about the common symptoms and the hereditary nature of it. This description, however, did not get much recognition as it was not translated to English until 1959. George Huntington was the first person to provide a thorough description of Huntington's disease in East Hampton, Long Island in 1872. He was only 22 when he released a description of the disorder on a medical newspaper. Even though there were brief descriptions before, George Huntington explained the disease with a high degree of clarification and detail. Sir William Osler was a physician who was interested in Huntington's disease during the same time as George, and he had this to say about George's article. In the history of medicine, there are few instances in which a disease has been more accurately, more graphically, or more briefly described. So this just means that this just shows his credibility. So George called Huntington's disease chorea because that's what they called it back then, and now chorea is an alternate name for the disease. In this article, Huntington describes the disease in detail and accuracy by explaining the involuntary body movements, the depressive emotions, the memory lapses, and in the rest of the paper, he talks about all the other physical and psychological effects. He also says that the disease is more prevalent in women, which is still true to this day. By the end of the 19th century, Huntington's disease was recognized worldwide. Now we know that Mendel's work went unnoticed during his time, but during the rediscovery of the Mendelian inheritance in 1900, William Bayesian established that Huntington's disease was inherited as a Mendelian autosomal dominant disease. And William figured this out by using pedigrees from affected families to discover the dominant pattern of inheritance. And there was a lot of stigma surrounding Huntington's disease during the 1900s. For eugenicists during the 1900s, Huntington's disease was an example of a severe hereditary mental and physical disease, and they believed that the disease could only be prevented through non-procreation and sterilization. And in 1942, the province of Alberta added an amendment to the 1928 Sexual Sterilization Act, which allowed involuntary sterilization of people with Huntington's disease. And they did this so that less people with this disorder will pass it down to their offspring. In the 1930s, people with Huntington's disease were treated as witches by society and were publicly burned to death. But we have moved on since those times, and we definitely won't have to worry about anything like that now. In 1983, scientists and researchers discovered the location of the gene responsible for Huntington's disease, which was chromosome 4. Huntington's disease was the first genetic disease to be mapped using DNA polymorphisms, which are variants in the DNA sequence. They act as biological markers which help scientists locate genes that are associated with a disease. The gene known as Huntington was isolated and the mutation was identified in March of 1993. The Huntington gene contains a DNA sequence that consists of 3 nucleotides, cytosine, adenine, and guanine. These nucleotides are repetition, and this is known as a trinucleotide repeat. When a gene is mutated, an excess number of copies can occur, and a mutated form of the Huntington gene is created. The higher number of repeats, the greater risk of disease. And you can see here in this picture that a normal gene will have less than 27 repeats, while a disease gene will have more than 35 repeats. The disease can sometimes even go up to 80 repeats in extreme cases.
Moving forward, we have the effects that Huntington's disease places upon the victim. This is just a range of what some possible symptoms that may occur. Usually, the age where Huntington's disease symptoms arrive are at the ages of 30 to 50. This is just a common range, but they can appear at any age generally. As the disease progresses with age, symptoms usually start getting worse. Key symptoms include personality change, mood change, problems with memory, thinking and judgment, and depression. The development of symptoms vary from person to person. Usually, mood changes or behavior changes are common for symptoms. Other symptoms can be dominant over other, causing a greater effect to happen, but this can also change over time. Digging deeper, there are certain physical aspects that can change your body. These changes can be divided into two categories: controllable movements and uncontrollable movements. Within the range of controllable movements, symptoms such as speaking or abnormal eye movement occur. Within uncontrollable movements, fidgety or flicky movement of arms, legs, and body, jerking parts of the face and head, as well as lurching or stumbling are common symptoms. If the controllable movements are more severe than the uncontrollable movements, it can affect an individual much more, as it has a greater impact on work, daily activities, communication, and the ability to remain independent. As Huntington disease progresses, the uncontrollable movements are becoming worse as they are more often and more intense. Huntington's disease also impacts the victim's lifestyle, as Huntington's disease makes it harder to move, chores, and work become much more difficult. To put in simple terms, you basically have to try really hard to do easy tasks, as your muscles may not have enough strength to continue doing those tasks. Some examples include difficulty organizing or prioritizing tasks, the lack of flexibility to get stuck on one thought, behavior or action, difficulty learning new skills or information, and slowness in processing thoughts. If you are unable to complete a certain task, it is advisable to ask assistance from any nearby family member or friend, or even someone who could help full time. Physiological effects of Huntington's disease include insomnia, fatigue, weight loss, difficulty swallowing or speaking, impaired gait, posture, balance, and the loss of coordination and control in movements. With Huntington's disease, normal functions such as sleep, eating, and walking become more difficult. With these functions being impaired, the disease really takes a toll on how life is planned throughout the day. With less sleep, it's hard to function. The same with eating and walking. As you can see a little picture here, it is how the different gaits are compared. On the left we have a normal gait, and on the right we have abnormal gait. Although Huntington's disease isn't harmful itself, the symptom causes the disease to be life-threatening. Since you lose weight really fast with Huntington's disease, it actually becomes life-threatening. This is because as you keep on losing weight, the symptoms end up becoming worse, and it affects your immune system, which allows infections to enter your body. With Huntington's disease, pneumonia and other infections can cause a person to die. Pneumonia inflames your lungs, which makes it harder to breathe. Coughing and headaches are also caused by pneumonia. As muscles are affected, the muscles in your throat have a hard time being in control, so swallowing becomes difficult and could be life-threatening. People who are commonly affected by Huntington's disease are usually in the range of 30 to 50, but anyone can be affected at any age. People who were affected earlier have less time to live than people who were affected later on. 3 to 7 people 3 to 7 per 100,000 people of European ancestry are affected by Huntington's disease. The disease is less common in populations including those of African, Japanese, and Chinese descent.
Treatment opportunities. There are lots of medications available for Huntington's disease, like movement control drugs such as xenazine and Austedo, which help reduce uncontrollable movements. Be aware, these medications do have side effects, like restlessness, drowsiness, and risks of making other psychiatric conditions like depression even worse. There are also mood-stabilizing drugs, like Depakote, Carbatrol, and Lamictal, to help with the uncontrollable psychiatric aspect of Huntington's, like bipolar disorder. Available to you is also psychotherapy or talk therapy, which helps you with your behavioral problems, as well as help find ways for you to cope with having Huntington's disease. Your psychiatrist will monitor your health and progress of the disease, and will handle communicating these results with your family members. You also have speech therapy, as due to the nature of the disease, you will have a hard time with functions like eating, swallowing, and speaking. Our speech therapists specialize in improving your speech with exercises or may refer you to alternative communication devices. If you want to take a different approach, physical therapy allows for you to cope with the disease through safety exercises focusing on improving your balance, coordination, and flexibility, which in turn reduce the risk of falls. You also have occupational therapy, which is the type of therapy utilizing useful, everyday devices such as handrails, eating and drinking tools, as well as devices for bathing and dressing. Diagnosis. There are 3 types of evaluations you will be conducted for. Neurological examinations will gauge your motor skills, like your balance, muscle strength, and reflexes. Your senses, like touch, vision, and hearing, as well as your psychological well-being, like your mood and mental health. Neuropsychological testing will gauge your memory, mental agility, speaking and writing skills, and spatial reasoning. A psychiatric evaluation, on the other hand, will evaluate your mental health, emotional state, behavioral patterns, judgment skills, and any symptoms of disordered thinking, as well as signs of substance abuse. You may be referred to an MRI or CT scan in order to acquire your brain image, to assess the structure and function of your brain. This is because areas in the brain affected by Huntington's disease may be revealed in this image. After all these evaluations, if you meet the criteria for the disease, you may be referred to a genetic test to evaluate the defective gene. This is especially crucial if there is no signs of the disease along your family tree. In the case that Huntington's disease does show up in your pedigree, a genetic test will be conducted. Be warned that there are risks, such as problems with insurability and future employment, as well as the anxiety of having the Huntington's disease itself.